Hey guys, the past couple months has been very stressful and difficult for all of us. We've seen a lot of close friends or family members getting laid off, some people getting sick, and we've lost some lives. As we're dealing with COVID-19 and the pandemic, few simple things like even getting a haircut has become impossible. Going to see your dentist has become very difficult unless it's an emergency. I'm a general dentist and I would like to share with you guys few effective and cheap prevention methods that can help you guys protect your teeth until we go back to normal. It's very difficult to predict when we're going back to normal and when you're going to be able to go get your regular checkups and cleanings. So my goal is to help you guys protect your teeth as long as you can until we go back to the normal. A couple of risk factors I would like to talk to you guys about is diet and oral hygiene. So as far as diet goes, I would like you guys to eat less sweet stuff and also reduce the number of times you snack during the day. So let's look at a hypothetical situation. Let's say you wake up in the morning and you have your breakfast. After breakfast, you have a glass of milk with Oreos at like 10 a.m. Then you have your lunch. At 2 o'clock, you have a cup of coffee with a cake. At 5, let's say you have a can of Coke with some Doritos. You have your dinner at 7, and then you have some ice cream afterwards, and then you brush and you go to bed. So the goal should be to reduce the number of snacks you take between your main meals. So instead of having ice cream, cake, a can of Coke between your main meals, try to reduce the number of that. And then also you can substitute it with some healthy choices like fruits and vegetables. Or if you want to have all of those snacks in a day, try to have it maybe once and then brush your teeth afterwards. The next topic I want to talk to you guys about is oral hygiene. As far as oral hygiene goes, I want everybody to brush their teeth twice a day for 2 minutes. It's okay if you have a manual toothbrush. I just want you guys to brush and spend the time minimum 2 minutes. The key is to disturb the plaque that accumulates around your teeth after you eat your food. Of course, if you have an electrical toothbrush, you're at an advantage because if you don't spend that full 2 minutes, the oscillation and the mechanical movement of the toothbrush helps, the electrical toothbrush helps to remove a lot of more plaque compared to the manual toothbrush. The next thing we want to do is we want to floss at least once a day. I know a lot of people say, I hate flossing, it's disgusting. But it's very important for you guys to do it because it prevents you from getting cavities between your teeth and also have healthier gums. We don't know how long this pandemic is going to go on for and for how long dentists cannot see you for your cleaning. So you want to make sure you maintain the health of your gums and your teeth as long as possible. So when everything goes back to normal, you have healthy teeth. If you don't like flossing, use a floss holder. You can use a floss holder and floss again between your teeth. Another thing you can use is a water pick. Water pick doesn't replace flossing, but at least it helps disturb the plaque that is between your teeth. I usually recommend water pick for my patients who have crowns, bridge, implants, and that will help them clean underneath the bridge and implants and stuff like that. I will show you guys how to floss properly and brush properly. So now it's the part I want to show you guys how to floss properly. The floss that I would like to use is an Oral-B product. It's called Oral-B Glide. You can use any product you like. This is just what I prefer. The reason I prefer this material is because it's more like a Teflon tape. It is smooth and it doesn't cut my gums or doesn't cause damage. What I would like to do is I wrap it around my fingers, both hands. You can choose what fingers you want to use, any ones that you're comfortable, and then you use the other 2 fingers to push in between the contacts. So you go ahead, you push in between the contacts, you go in. The technique we're going to use is called the C-shape technique. Basically, you wrap around the floss like a C around the back tooth. You go in,
You floss like that. Then you wrap it around the front tooth. You floss like this. This way, as you're cleaning the contact between the two teeth, you're cleaning the gums in between the teeth also. Sometimes, and then you come out. Sometimes I have my patients coming in, they have no cavities between their teeth, but their gums are bleeding. And I ask them, are you flossing? And they say, yes, I'm flossing every night. So what makes me think is that their technique is not correct. So the proper technique in order to clean the teeth, between the teeth and also your gums, is to go in, wrap around the floss like a C around the front, go just like that, and then around the back tooth just like this. And then that way you are utilizing the C-shaped technique, which cleans the papilla, the area, the triangle between the two teeth, and also the contact where you can feel that clicking. You have to do this for all the teeth, the back teeth, as well as the front teeth. So all the teeth in the mouth, you have to be going with the floss in between them and clean them. At this point, I would like to show you guys how to brush properly. The key is to use a soft bristle toothbrush. You do not want to use medium or hard bristle. It damages your gums and your teeth more. So use a soft bristle toothbrush. How you would like to do brushing is you want to come in, you want to do a circular motion, just like this, circular motion, and brush all the teeth. What you do not want to do is scrubbing like this. When you scrub like this, sometimes you see some notches around the canines, around the gum area. You see these notches and like indentations. That is because either you're biting too hard and you're grinding your teeth, or you're brushing and scrubbing like this. So you want to go circular motion, just like this, very gently. And remember, the key is to do it for 2 minutes. That's the key. You have to do it everywhere. So you do the chewing surface, the sides, circular motion, and on the inside also. In some patients, what happens is the cheek gets in the way over here on the top. So what you have to do is, instead of having your jaw open all the way, you have to close halfway, and then you can reach the back side on the top. And you can brush properly like so, using circular motion. So this way you can clean all the areas, and you do the left side, the front, the right side, upper and lower, all the areas for 2 minutes. So now let's talk about if you have an electrical toothbrush. There are different types of electrical toothbrushes. One that rotates, the tip rotates, and one that is ultrasonic. I have the tip that rotates. In this case, if you have an electrical toothbrush, you want to just let the toothbrush do the work. So basically you just leave it on the teeth, and you don't put pressure, and you just let the toothbrush do the work. Again, you can do circular motion, but allow the toothbrush to do the work for you. Because in this case, this toothbrush, it rotates, the tip rotates, and by rotating, it dislodges all the plaque around the teeth. Some electrical toothbrushes, they have a pressure sensitive indicator. So they will tell you if you're pushing too hard with the tip on the teeth. And that way it eliminates you from pushing too hard on the teeth. Remember, as I was talking about, even with the manual toothbrush, you don't want to push too hard, and you want to do circular motion. So in both cases, you want to do circular motion. With the electrical, you want to allow the toothbrush to do the brushing for you, and do not put a lot of pressure. This way you protect your teeth and also your gums.